how healthcare marketers can use data without crossing the line. There's a lot of anxiety about using, is this compliant, non-compliant? Am I allowed to do this? Is it going to sound creepy?
As a consumer, why can't I manage my healthcare ecosystem the same way I manage my banking? Why can't I buy prescriptions and book appointments or the same way I purchase airline tickets?
A lot of hospitals kind of went blind. They had
Mhm.
no idea who was visiting their websites apart from like these very high level stats. And I think a lot of hospitals got burned because there was lawsuits and were very scared about using this personally identifiable information.
You know what? Hospitals, you can't use Google
Right.
Analytics, right?
Exactly.
Because we're not HIPAA compliant. So that's a non-starter. Rather than make our platform HIPAA compliant, we're just going to say, you stop using it.
I love your interpretation of the consent being just another data point because I feel that there's consent for me feels like it's the gatekeeper. It's at the beginning. Like if you don't pass this consent gatekeeper, nothing else can happen behind. Stop overthinking it. Do something small. Get a small win. And baby steps kind of to get to the solution. It's like the crawl, walk, run. Hi, everyone. I am Brad Munch. I'm CEO of Symetris. We are a digital agency focused on helping hospitals and health systems extract the maximum amount of value from their websites. And today on the pod, we are going to be talking about personalization without the creep factor and how healthcare marketers can use data without crossing the line. So healthcare organizations have a lot of data. Some is PHI, some is non-PHI, and there's a lot of expectations that are rising for consumers. Just a great example is ChatGPT Health that just came out, and that's hyper personalized to each individual's health experience. And on the healthcare marketer side, there's a lot of anxiety about using, is this compliant, non compliant? Am I allowed to do this? Is it going to sound creepy? And so this conversation is all about how to unpack how healthcare marketers can actually use that data in compliant ways and practical ways, and why maybe we're not only aiming for one-on-one personalization, which might be the holy grail, but there are levels of personalization that can make the experience still feel relevant. And I've decided to invite today Tom Swanson. Tom Swanson, who spent nearly a decade at Adobe, helping bringing Adobe Experience Manager and the overall Experience Cloud to healthcare, to life sciences, and navigating the HIPAA and the data and the personalization in these highly regulated environments. So he's been there and done that. And from pharma to insurers to health systems, he has that perspective on what has actually worked, what has broken down, and he has great stories to tell around this. So Tom, welcome to the podcast. I'm glad you're here.
Thank you so much for the invitation, Brad. I really appreciate it. I'm looking forward to the conversation because I think personalization of digital experiences in healthcare is a critical component in kind of moving, how health systems engage their customers. Because I think one of the things that you said is really important, right? That consumer expectation is driving, right, this need for greater levels of personalization. And it's really interesting to think, right, what kind of a paradigm shift that is in the industry of having consumers, right, or the customers or the patients actually driving expectations versus it being system centered or physician centered the way it was for 100 years or more.
Absolutely, 100%. And it's really, uh, uh, it's a tough industry to make change, right? And so that not only because of all the regulations, because of all the habits and this idea that, that the physicians are the ones who should be deciding about the health of the consumer. And now consumers are arriving with all these questions. This is how I want my experience to be. So it's not only digital, right? It's overall. So I'm excited to see how we can meet the patient where they are, right? Instead of just saying, well, this is the way we've always run and this is the way it should be going, in the future.
Well, I think it's really interesting, right, that both of us have used the term consumer, right, when it comes to talking about, the people who are engaging their healthcare ecosystem. Because I think thinking about, right, your customers, as opposed to thinking of them as patients or caregivers or, healthcare professionals themselves, thinking of them as consumers is actually a really important kind of psychological shift. Right. Because when you think of a consumer, you think of someone who is kind of doing research, making an informed buying decision, and then getting value or not getting value from that buying decision. And I
Right.
think it's really important to think of healthcare engagements in a very similar way. Right. It's like, people are out there researching, health conditions and treatment plans and places or, hospitals where they can get that treatment. They're doing all of that research now online. You mentioned Chat GPT, right? And the ability to actually completely personalize the information, right? That you're getting back from that AI, so gone are the days of where you're reliant upon the quote unquote expert of the doctor, him or herself, in order to kind of get this information, right? As an informed consumer, man, you are rolling in to that appointment or into choosing who your provider is going to be with all kinds of information that 10 years ago you didn't have.
Absolutely. And how does that, right? So this consumer behavior where I want to interact with healthcare the same way I'm interacting with buying a plane ticket or purchasing something on Amazon, or even in a very similar context, let's say the bank, right? And like they have these great personalized experiences. Obviously, I think I'm saying obviously, but just there is a nuance between the logged in or authenticated experience, which is obviously way more personalized because you're logging into a system, and that's oftentimes managed by the EHR, whatever the my chart and the Epic and stuff. And that there's a line right now, and that line is starting to blur, but it's still very clear. And then there's the experience that one has when they're on the public, quote unquote, a version of the website before they log in or as they're shopping, right? And talking about
Mhm.
consumers shopping for their healthcare. What are ways that you've seen health systems and other organizations personalize that experience? I think there's different levels, but let's start by first saying, let's say we don't have that much information on whoever that person is. We don't know. They're kind of anonymous. So what were ways that we can personalize that experience like off the bat?
Well, I mean, I think the easiest way of personalizing that experience is simply using the IP address, right? Where the search or where the web interaction is coming from. Right now, of course, there are certain limitations, right, around that. They may be using a VPN or they may be using a mobile device, right, that's connected to a cell tower that's not
Right.
whatever, right? But by and large, right, the IP address is going to give you that geolocation. And something as simple as that, as making sure that you're serving up content on your website that is relevant to the location that that person is coming from, it makes a huge difference kind of in the consumer perception as to, you know what, these guys kind of already know a little bit about me, right? They know where I'm coming from. I mean, one of the best examples that I saw when I was working with Adobe was with our customer Mercy Health
Okay.
out of the St. Louis area, right? And of course, this was the height of the pandemic, which you and I, Brad, have talked about how the pandemic was really kind of that tipping point
It was, yeah.
that forced the industry into engaging in digital channels and actually kind of forced the industry into utilizing the data that they were collecting kind of in a more proactive way in order to personalize those digital channels. And so what Mercy Health did was really interesting, right? Because so they utilized the IP address of where this person was coming in, and they would kind of dynamically in real time serve up the content that was relevant to the closest facility for where that IP address was coming in from. And by the content that was relevant for that facility, of course, because it was the pandemic, it was, when are vaccinations available, right?
Right.
Kind of how long
Wait
is the wait
times.
time,
Right.
right? And they did something that I thought that was really interesting was once you opted in, right, they had a very rudimentary chatbot, right, that said something like, you know, How are you feeling? Do you have a temperature? Like 3 or 4 questions. And then based on that answer, they were given in real time a recommendation of come to the facility, right? Or, you're fine. Try these other alternatives as a means of kind of governing the traffic, right? That was
Right, right,
actually going to go to the facility. So, I mean, all of that, right, was a very simple and kind of prescriptive way of kind of gaining trust, right? Because
right.
the consumer knew that they were talking kind of to them about the area in which they were. And then by asking some very simple questions, right, you were able to kind of get that opt-in, right, that
Right.
would then enable you to do more, right? Because Brad, you said something at the very beginning, right, that there's a huge difference between authenticated and inauthenticated. And getting that proactive opt in, right, so that you can now begin to authenticate the experience is critical. Right. So doing these little things, right, to personalize the content that's coming up based on IP address, based on kind of search history, right? What is it that they were looking for before they decided to, jump to your website?
Yep.
Those things are the kinds of things that you can use in a compliant way to personalize the content that they're seeing. And then once a consumer kind of understands that a little bit about them, they're more likely to take that action of opting in.
And I think it's interesting to see that kind of scaling, I think, of the personalization based on how much the patient or consumer is ready to allow that to go, right? Because you go to the website, step one, right? And so you're not that personalized. Then you consent to saying, yes, you can use my location, right? So that's a first level of consent that they're saying, because if you don't, well, you won't be able to geolocate and whatever, you'll write in your address or something.
Right.
But then so you got, okay, I consent to give my IP address and location. Then, as you said, then there's that next level, which is, okay, well, here's a form that would have a valuable information for you, right? And it can't just be like, oh, let's give me more information about you. There has to be something in return, right? And so in this specific COVID case, it was like, hey, we'll be able to give you an update on wait times or best times to come, or the vaccine schedule or something. And then okay, great. Once they give that email to you, then you're at a second level, right? You're not necessarily authenticating in the sense where you don't have an account or you're logging in, but you're that other level of personalization that you can get. So now you're going to get specific emails based potentially on past behavior. And then at a certain point, if you become a patient of the organization or a client or a consumer, then there's going to be, here you have to create your own MyChart account. And so you can log in and, manage your appointment and then show up and stuff like that. So it's interesting that there's different levels, right, of that consent that connect with different levels of personalization, right? And in a sense.
No, absolutely. Right. And I think it's important to recognize, right, that there are those different levels of not only consent, but also personalization, right? Because I think as a consumer, right, there's this expectation to get one to one personalization. I mean, like you mentioned it at the very beginning of our conversation when you were talking about as a consumer, it's like, why can't I manage my healthcare ecosystem the same way I manage my banking? Right. Or the same way I purchase airline tickets. Why can't I buy prescriptions and book appointments and do
Exactly, right?
all of that in the same way? Right. But I think it's really important to recognize that it is kind of a continuum of getting from being anonymous to that one-to-one personalization. And you have to be deliberate and
Yeah.
be kind of empathetic and compliant as you're kind of shepherding your consumer down that path, right? In order
And
to,
it's kind of directly correlated with trust, right? Because the consumer is not
yeah,
going to give you that access or that consent if they don't trust you along the way.
correct.
So how do you create an experience that shows that they can trust you?
Well, and it's a matter of demonstrating that you kind of understand who they are, where they are, what they're interested in, and that you're not going to waste their time, right, by serving up content or providing them with information and such that's not relevant or that they're not interested in. I mean, we at Adobe, we did a study a couple of years ago with our partners at Harris Polls that indicated that consumers, 65% of healthcare consumers were willing to share PHI with
This is a
their
couple of years ago, right?
this was a couple years ago, right? But they're willing to share PHI with their provider and with their payer if there is a tangible and recognizable value in exchange for giving that information. I thought that was pretty remarkable, right? That more than half of consumers are like, and if you think about it, consumer behavior is such now that we're all far more comfortable sharing personal information online. I mean, you mentioned
I
Amazon.
mean, that's a couple of years in the sense where since that was a couple today, I wouldn't be surprised if it wasn't like it's in the 70s or higher,
It's,
right?
I agree, it's probably higher, right?
And so, okay, so I think this is really interesting because now this is where the conundrum is, where we have the consumers who are open to, I'm okay to share this PHI data. I want a personalized experience. If I trust you, I'm going to allow you and give you that consent. But then we have the other side of the equation is I'm a healthcare marketer. I'm working at a hospital system. And then like we had that earlier, you were talking about, hey, in COVID, we did this IP address thing. But then like a year later, which is about 2 years or so ago or a bit more, then there was that announcement of the decision about PHI and what's being tracked, and then Google
Mhm.
Analytics and the Pixel. And then that was like, Armageddon about analytics and stats because everybody was tracking everybody on the website. And then suddenly you couldn't use Google Analytics, you couldn't have a Facebook Pixel. And so a lot of hospitals kind of went blind. They had
Mhm.
no idea who was visiting their websites apart from like these very high level stats. And I think a lot of hospitals got burned because there was lawsuits and were very scared about using this personally identifiable information. And so how does a healthcare marketer now navigate in this world where on one side there's these consumers pulling and saying, hey, give me more, I want this experience to be adapted to who I am, and then on the other side we have legal and compliance saying you can't use this data, you have to be 100% compliant. And then the like, okay, well, what can I use? Can I not use? Can I send an email to someone who filled a form at some point on my website? Am I allowed to do this? Am I not? So how have you seen people navigate around adapting to that new reality where it was not as clearly defined originally as it has been over the past couple of years. And there's a lot of these tools now that are appearing to anonymize that data as they're going through the website to avoid the consequences.
Well, it's a great question, Brad. And the anonymization of data, I would actually argue, while it's effective, right, for that kind of first step of the personalization continuum, it actually strips out most of the information that would actually truly be helpful, right, to personalizing an experience. The kind of the rationale behind, right, HHS's declaration, right, about to Google Analytics and Meta and all of that was essentially because that data was being collected without consent,
Right.
right? And that data could potentially point back to a particular individual, right? Based on kind of where they're located, if they're in some rural area or some little town, right? And they're searching on diabetes, and everybody
Yep.
knows that old Tom has diabetes, right? That, now suddenly it's no longer just an IP address, it's
Right. Right.
pointing to a specific individual. That
Yeah, but
that was
at the same time, I think that one of the big elements of that was that then Google and Facebook were reselling that data to third-party advertisers who now
yep,
suddenly you're going to get an ad for, whatever diabetes treatment, right? And I think
yep.
for me, that was the essence of that decision where, and again, these things evolve quickly and there's all kinds of interpretations of it. But from what I understand, and I'd be interested to find out from what you've seen as well, is data that you've collected and that you own, right, as a system and that you're not sharing with a third party is information you're allowed to act upon. So if I'm tracking someone who went on my website and I have their IP address, but I'm not sharing that information with someone else, I can use that data as first party data
Yep.
and, remarket to that person if I want to.
That's 100%, Brad, right? And so there's a few things in there that we can unpack, right? Is as long as what you're using is first party data, right? You're kind of safe using that data. Another component of that is how you are collecting or ingesting that first party data, where you're storing it, and ultimately where and how you're going to use it need to be HIPAA compliant, right?
Yep.
Or HIPAA ready, right?
Yep.
So you need to, you're collecting this web information, right? That is an IP address, right? Well, the government has determined that an IP address is potentially PHI.
Hmm.
So the best thing you can be doing is storing that data in a compliant kind of
Yeah.
place or environment. And
Yep.
so if you're doing that, right, and then you're only utilizing the data that you have been given consent to use, or you're only utilizing data if it's not consent, right, but they have provided you an email, right? And so you can in turn respond to that email, right? That's an implied opt in. Those are all kind of ways, right, that you can personalize experiences in a compliant, safe way, as long as you're using a compliant environment and you're being very diligent about who has access to the data and how the data is being used. We talked about kind of Google Analytics. Well, Google Analytics, which was or is free, right? They came right out and said, yeah, no, you know what? Hospitals, you can't use Google
Right.
Analytics, right? Because
Exactly.
we're not HIPAA compliant. So that's a non starter. We, rather than make our platform HIPAA compliant, we're just going to say, you stop using it, right? What that
Right.
did is it actually opened the door for other providers of analytics that are HIPAA compliant,
Right.
right? So, I mean, you're correct in that kind of when that decision came down, there was a lot of kind of angst on the part of legal and regulatory, and hospitals went dark. But one of the things I've seen is most of the hospital systems have now since moved to,
They migrated. Right.
yeah, a HIPAA compliant data platform, be that Adobe or Salesforce or Fresh Paint or Optimizely, right? Whatever it might be, as long as you're kind of collecting that data, storing it, and then using it, right, in a compliant way, that should ease, right, the concerns or the tension with the legal and regulatory. Now,
Right.
we all
Yeah. Yeah. Go ahead.
I was going to say, we all know that healthcare is extraordinarily conservative and that the legal teams are always going to tell marketing, no, right? Nope, can't use that data. Nope, you can't say
Yep.
that. No, right? I think it's the burden of healthcare marketers to demonstrate, right, that they understand, right, the
Hmm.
concerns of legal. They have done the due diligence around only collecting the data that is necessary for whatever that particular campaign or whatever that particular personalization is,
Right.
and that they are managing and using that data in a compliant way. And then I think the next step, Brad, and you alluded to this earlier, is consent and making sure that you have a viable and compliant consent engine where you're essentially just treating consent as another data point that can get attached to a particular customer, right? Where if they have granted you consent, right, to use a particular piece of data, you only use that data in the way that they've given you permission to use it. If you stay within those boundaries, I don't think you're ever going to run afoul of what legal is trying to protect you from.
No, that's interesting because I've always, I don't know, I love your interpretation of the consent being just another data point, right? Because I feel that there's, consent for me feels like, it's the gatekeeper. It's at the beginning, like if you don't pass this consent gatekeeper, nothing else can happen behind. But basically, it's the consent is just one of those elements of like, oh, well, we have this information. Yes, we're allowed to use it. No, we're not allowed to use it, kind of thing. And I find that's a really interesting way to maybe just remove the kind of hype around that idea. Was well, it's important to get consent, but it's the same as getting other types of information about that patient. Obviously, there's a impact attached to the consent that's going to get all that stuff, but that's a good way of putting it.
I think another thing that's important, Brad, is to think of consent as being fluid, like other pieces of data, right, that you're going to be collecting about your customers. In that, right there, you may get a customer to opt in,
Yeah,
right, to be communicated with. And through the course of that communication and the personalization of the experience, you may ask them, right, hey, can I use this particular piece of PHI, right, in order to help you receive a better experience or better treatment here, right? And the customer gives consent for that. Well, that consent is constrained to that piece of data for that particular program, right? Or whatever it is that you've promised them in return for permission to use that data, right? You cannot use that data in a different program or a different campaign. And you need to be able to manage that consent that if the patient changes their mind, you can
right.
remove it, right? And so that's why I think it's important to be thinking about consent as just another data point. Yes, to your sense, a critical kind of gatekeeping at the beginning data point, but
Yeah,
it is a data point that you need to be able to proactively manage, right? So that, if the customer's behavior or their perception or whatever it is, right, changes, that you can change how you're managing their data accordingly.
yeah. And so what would we so we talked at the beginning of the conversation about, hey, we can have levels of personalization that are lower level, easier to manage, like IP address and the nearest location and stuff like that. And now we've talked about how we can get the consent and get the data and first party information that we can use to personalize. And so once we do, let's say we're at that level where we are comfortable about personalization, we have had the conversations with legal, with compliance, and we do want to put into place effective personalization strategies that are not in the logged in experience, right? And they're before that logged in experience. What, from your experience, have been the most valuable ways to use that data to personalize? Is it by, having specific email campaigns to people who have accepted to receive these types of emails? There's like also, and I don't know at what point we can get into the details of that, but larger, more sophisticated systems are able also to connect data from the electronic health record of that patient with the marketing team so they can send specific interactions to that person that are not necessarily specifically related to their health journey but overall their relationship with the system. So what have you seen as being the most successful ways to personalize in healthcare?
The most successful way to
Yeah, then you feel like that if I suddenly get to the point as a system say, hey, you know what, I've checked all the boxes, I can personalize. What should I start with?
it sounds simple, right? But you should just be starting with content, right?
Okay.
However it is that you want to define content, right? So content can be an email, right? Content can be an attachment, right? That's in that email.
Hmm.
Content can be whatever you serve up in the website or in your app, right? That is educational, right? Or that is kind of directing the patient or the customer as to kind of helping them make a decision or kind of steering them in the direction of here's how you're going to follow this procedure, whatever it might be, right?
Right.
So you should be thinking about content, right, that is specifically targeted for or relevant for that person based on the data, right, and the understanding that that data is giving you, right? It goes back to this idea of building trust,
Hmm.
right? Because you're essentially demonstrating to the customer, and I said this earlier, right? You know who they are, you know where they are in their personal health journey, or if they're a caregiver for someone else, you just know kind of where they are in their journey, and that you are respecting that information by only providing them with the content, right, that actually is the most resonant or most relevant for them. And so I think it's critical, right, to be thinking about how can you organize your content, right, so that it's easily identifiable based on the analysis, right, that you're doing, and that your system can in real time, you know, take that analysis, determine what content should be served up, and deliver it in the appropriate channel to the customer, kind of all in a seamless, real time way, right? That is how you get from that kind of anonymized to the basic baby steps to
Right.
one to one personalization,
Right.
is by essentially being able to dynamically determine what the customer is going to see at the time and the place that it makes the most sense for the customer.
So the so what I'm hearing from you in the kind of the two places, or extrapolating from what you're saying, the two maybe places where I'd probably see it as maybe the lowest hanging fruit is, one is in the CRM, to be able to communicate to that person about a specific action that they took on the website where they did provide their email in exchange for something. And the other one would be on the kind of cookie side of their actual behavior of the website, where they might have visited a certain number of pages or gotten to a certain point in almost booking, let's say, a physician, and then finally like going to navigate elsewhere, and then maybe having some relevant box on the side of the like, you didn't complete your booking or something like that, had the, again, all this being in the context of having given consent prior. So those would be like two examples of ways one would personalize in concrete, tangible ways.
Yes, spot on. But you said it right there at the end, right? As long as you've got consent. And I think it's always better for healthcare marketers to err on the side of delivering content behind an authentication,
Hmm.
right? If you can get that authentication, right, through the consent journey,
Yeah.
that's now where you are safe to deliver any content, even if that content can be considered PHI because it is relevant to a specific care journey. Because you're governing who can actually access that information. So, in order to get the degree of personalization that consumers want, right, there's going to be a trade off, right, that you kind of have to authenticate in order to get that. And I firmly believe that consumers are willing to kind of make that trade.
Hmm. Okay, that's interesting. I'd be interested in finding out like what are the stats around that, where like the kind of a pre-authentication before actually becoming a patient, right? Like what's being done, or what's the best practices around there. There are, I was talking with I think it was Sean Gross about progressive profiling, right? Where in a first time you visit a website, you might fill in one or two elements of information, but now that they have that, when you visit it again, you might have another type of
Yep.
information about you that you're sharing slowly, and that can kind of build that profile around you and can start giving you some content, as you mentioned, that's more personalized to that specific experience. So we've talked about all the levels of personalizations, the risks of personalization, how to approach it correctly, the impacts, the best ways to deliver it. And just kind of in closing, what I would like to get from your perspective is, let's say I'm a healthcare marketer. I'm a bit kind of stressed out about this whole personalization thing. Maybe it seems too big. Maybe it seems too scary and dangerous. Or maybe I think that it's going to be such a slog trying to get through legal or whatever and compliance through all this. So if there was one mindset shift that you would want that person to try to have, or like, hey, this is what you should shift in the way you're perceiving personalization and that personal information and how to use it, what do you think would be that perspective shift that would be valuable for a healthcare marketer?
Well, I think what is paralyzing, Brad, is the term of kind of boiling the proverbial ocean, right?
Okay. Okay.
And it's like, oh my God, we've got all this data, right? And
Yeah.
and legal says you can't use any of it. right? So I think it's really important to shift your perspective into being very specific
Okay.
about, right? Who is it that you're targeting? What is it that you want them to do, right? And then what is the specific data that you need, right, in order to get them to do what the action that you want them to take? And
Mm,
then what is the timeline, right, around how long you're going to be collecting and using that data, right? And then making sure that you have the process in place that you can safely and compliantly kind of remove or eliminate that data once whatever it is that you're trying to do, right, has been accomplished. By putting very specific boundaries around, we're only going to be targeting these people for this specific purpose, and we only need these data points. And then once we're done, we're going to dispose of that data, so that we're not like storing it indefinitely. That should be kind of enough to give legal the comfort, right? This is very limited for a limited period of time.
right.
So let's go ahead and try it.
So kind of reducing the scope, pilot project. Let's see if this works. And that's fascinating because a lot of the times when we're talking about just technology and digital in general, I think a lot of people and a lot of our clients are always kind of assume that this has to be like a huge paradigm shift for the whole organization. And it often does come down to this idea of like, hey, stop overthinking it, do something small, get a small win, do that. And if that has a proven record, let's do something a little bit bigger, right? And baby steps kind of to get to the solution. It's like the crawl, walk, run, because
Yep,
everybody's looking at that run solution, like, how am I going to implement this mega personalization kind of thing, where that's not the direction, like that's not the best path to get there. Like start small and then grow on those wins, and then you'll get there. Maybe it's going to take 5 years, maybe it's going to take more than that, but at least you'll have that baggage, that experience that you've built over the years of how what works, what doesn't, and where to focus.
exactly. Spot on.
All right. So thank you so much, Tom. This was a great conversation. I love your insights, and hopefully this is going to be helpful for anybody who's listening.
Yeah, man, I look forward to doing this again someday, Brad. Thank you.